Mr. Henry, I keep, for some reason, I keep going back to a question that Congresswoman Presley asked a little bit earlier of the other panel. And she talked about stigma. And when I heard you say that you all were able to gather everybody in a room, the people who make a difference, I assume the people can make decisions, and I guess you're talking about the business community too, I guess. How did they do that? Because Mr. Heights and I were just talking about how you all have apparently been able to do something to get past this thing of, oh, it's their fault, or when you see the child in need, here they go again, that, that kind of thing. How do you get past that? And living in the inner city of Baltimore myself, going back to something you said, Mr. Patterson, I look at some of the children and I wonder how they even get to adulthood. I mean, with all the forces going against them. So I'm just, how did you do that, Mr. Henry?
Well, I think number one is they have to be aware of what's going on.
Yeah.
I mean, there are so many people. There are a lot of kids involved here and a lot of impact from this. But not many people really recognize it. It's a lot like dealing with people with disabilities. For a long time in this country, we didn't realize exactly what we were dealing with. We did just the opposite of what you ought to do with those kind of things. I mean, we hid people with disabilities. We segregated them. We did all those things. I had a son with disabilities. He passed away, and had terrific disabilities. But the best thing for him was when he got out with people and they treated him normal. And you've got to have mentors. You've got to have these organizations that are willing to step up, and you've got to have somebody at the head of it that can draw that kind of crowd. The governor of our state took the lead, and his wife took the lead.
It's about leadership.
And there is no substitute for that. And in Memphis, it was A.C. Wharton, and A.C. took the lead, and the Pyramid Foundation, and we brought all those people together, and some of my best friends in the legislature. I've served as Republican leader for a number of years under Governor Alexander, Senator Alexander. And the way we did things was that we worked together. I mean, there are very few partisan issues. When you look at kids' education, these kind of things, I mean, it's bigger than partisan. So we agreed on those things, and we used part of that coalition, and we still do today. I mean, to bring people together and tackle these terrible problems. I mean, Tennessee's got huge problems. They're one of the biggest perpetrators of drugs. Alcohol, smoking causes 42% of our total health problems. Wow. Smoking. And, and because we've got a history of raising it and being it, and it was the manly thing to do when my dad grew up, was to smoke. But he had a heart attack when he was 56 years old, and didn't, and he survived for another 20 years, and then he got poisoned working up at Oak Ridge, and thank goodness that the Congress appropriated the money in the 80s to take care of some of those folks that died of exposure to radiation. But it's got to be an all-out effort. It can't be 4 or 5 people in a state.
I just have one other question, and that is to you, Dr. Bethel. Piggybacking on what Mr. Henry just talked about, you said that so often folks are doing things that actually are hurting the kids instead of helping them. Can you elaborate on that? And he said, I want to hear from her right now, but go ahead.
Yeah, I mean,
You did say that, and make sure your mic is on. Go ahead.
I did, and I can give you a very concrete example
Yeah,
from
that
that
would be
same
wonderful.
meeting that I was at a month ago where most people didn't know about ACEs when they learned a Title V special health needs specialist that was going into the home to treat a child with autism and noticed that the mother was under extreme distress and also that the child was not able to focus by continuing to look at the mother and cry. And he wouldn't have gotten paid and he would have been reprimanded if he hadn't executed those exercises for autism treatment and had no way of addressing the issue because it was not in his purview, nor did he have any information about the other home care visitors and others that were treating the same family, and neither did the mother know all of the services that she was receiving. There was no way for them to work together, coordinate, and deal with this cross-cutting issue. Probably the traumatization to that child by being forced to do exercises that were not really what the issue was, made him feel like he had actually hurt those children. And when we talked about this in a later breakout, it went on for a good while what we could do.
You know,
That's
my
a
mother
concrete example.
My mother used to say, "It's nothing like a person who don't know what they don't know."
That's right.
And she only had a fourth grade education.
Yeah. But this person knew and couldn't do anything. Even.
And so you got almost the blind
That's right.
leading the blind. They're not only leading them, but they lead them in the wrong direction.
Right.
Yes, sir, Mr. Henry.
One final thing, now I'll quit preaching to you, Mr. Chairman, but, you know, kids are not inadvertently mean. That's a learned behavior. And I mean, if you raise them in the wrong environment, they're going to turn out unsuccessful most of the time. And we see a lot of times where somebody somehow pulls themselves up, and then you say, well, you can do it. If you'd pull yourself up, well, that's not reality. If you're raised in a bad environment, you're probably not going to turn out too good. Wow. If killing and drugs is the norm, that's what you're going to, you know, head toward. If not working is the norm, that's what you're going to.
My last question is, some of you have talked about this briefly, but what would you like to see us in the federal government do to help children? I mean, us in Congress. Dr. Shervington, would you have something?
Yes, government can really assist the coordination of these services. Like the gentleman said, we don't need the Department of Ed on one side, law enforcement on one side. I think we have our public health agency, the Centers for Disease Control. We have the more clinically oriented services in HHS, SAMHSA. I think that if those efforts were better coordinated, and I'm looking to the population level approach to even bring SAMHSA in, I think that it would be really helpful to communities when we have one message, almost one kind of science about how we're going to go ahead and heal. Thank you.
Mr. Patterson.
Having the hearing today, that's the start, right? Yeah. Talking about it and letting people know that it's out there, understanding that it is a root cause, and then continuing to provide evidence-based programming that folks like the CDC present to us so that we can implement it on the ground at the local level. We don't have the resources at the local level to try something that might work. In most cases, we need to put our local resources into an evidence-based practice that if we do it to fidelity, we're going to get a result. And so you can direct your research funding at programming that provides that local evidence-based practice.
Dr. Horry?
I think it's important not to lose sight of prevention, really primary prevention. All too often in the ER, I'd see it. We'd see that trauma, and I'd focus on how do I save that life? How did I prevent that injury from coming in the first place is key. And there's so many ways that can be done through early childhood education, promoting social norms, parenting skills, really connecting youth to caring adults, and we have evidence-based programs that do this. We need better evaluation of them. I think, as Mr. Patterson was saying, looking at some of the local innovations, being able to evaluate them and scale them up, and CDC is ready and poised to really work with Congress on this.
Mr. Henry?
Mr. Chairman, I'd just like to say I think the best thing you could do is what you're doing today. And you know, I think states need to make a commitment. Federal government doesn't just need to do this. If you can't get a commitment from the state to understand they've got a problem out there, you're just going to be wasting your money. But I mean, there ought to be some barometer of how a state, how they appeal. I mean, whether a legislature understands this issue. Are they willing to appropriate recurring money?
Right.
Not one time,
Right.
but
Sustained.
recurring money.
Yeah. Thank you. And finally, Dr. Bethel.
Yeah, first of all, there's a way to. We need to leverage existing programs and policies that are not fully implemented or brought to scale, including EPST, CAPTA, and many of the other programs that serve children already that do not integrate this information or are paying and training in ways that support their implementation. We also, I think, need the federal government to take the lead in creating a through any door awareness by being the leader, like in Tennessee, and being relentless in that. And then also all of the NIH programs that study any disease practically know that this is a factor, but it is not included in RFPs as a requirement for measurement. We have a lot of things that are, and we can start to learn more by integrating information about ACEs as well as protective factors, positive health, and engagement of communities and people, which is essential. And finally, to really help the communities that are out there that need an emergent process, even though there's evidence base, the truth is that this has to be tailored to the real people in a real community owned by them. And so we need common element approaches and supports to implement them with data, measurement, tools, and models that then can be used by communities where they adapt and make it their own, because unless we make it our own, nothing will change. This is relational and engagement-based.
Thank you very much. Ms. Miller.